Hello friends, I think you must have seen people who used to speak in a very strange way. You can see that their throat is becoming tight and their voice is almost inaudible. Sometimes you won't be able to decipher what they mean, whether they are telling you something, whether they are asking you, and the voice would be so broken and hesitant that it's almost impossible to understand him. There are many types are there. Sometimes there is something what you call the adductor type of spasmodic dysphonia. There is a spasm causing abnormal voice production, or there can be a abductor type, it can be a mixed type, or it can be a whispering type. You know, there are vocal cords here that's responsible for our voice production. Okay, this all mastered by your brain and wired through various wires as well as the subcortical structures. For the end organ is your vocal apparatus. There are many conditions can inflict or affect this particular organ. Sometimes you call the vocal cord palsy due to a nerve damage. There can be some various tumors and other problems there. There's a different entity altogether. Sometimes there can be a tremor, something like a voice tremor. When you speak up, the voice will be broken into various things. Sometimes it can be stuttering. You won't be able to get the first syllable, so you say la 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 la, something like that. I think you know that stuttering. Maybe I can make a video later on. So it can be voice tremor, there can be stuttering, there can be aphonia, it can be a dysphonia, abnormality in the speech production. There can be a tension type of many types of dysphonia, but the most common is the spasmodic dysphonia, where there is an abnormal production of your voice to such an extent that it is almost impossible to understand the person. Something you strain your voice to such that the voice will be totally broken into different pieces and you can't make it as a single effective communication. So the most common, as I told you, this one condition called adductor type of spasmodic dysphonia. It can be abductor type, it can be a combination, it can be whispering type also. Usually this is something what you call as a focal dystonia, so abnormal contraction of certain muscles, thyroid, retinoid and many other 2-3 muscles are there. Sometimes this runs in family, some genetic mutations are there, but usually this combination is a part of a dystonia. This can start in the vocal cord, maybe it can involve the face, the neck, the arms, limbs, etc. Sometimes this can be just confined to the vocal cord, causing this sort of abnormality in the voice production. So the investigation usually you don't need much, but maybe you have to check your calcium, your thyroid, laryngoscopy by the ENT surgeon, maybe a scan if there is any other abnormality like a Parkinson plus syndrome or a Parkinsonism or a Huntington's or a Wilson's or some other problem which are likely in certain age groups. Usually the incidence is 2 per lakh. Mainly females are affected. The usual age range is 30 to 50 years, and this actually a gradual onset, this is progressive. Rarely it can remit for some time. What are the various precipitants? We don't know exactly. Probably the overuse of your voice, or maybe infection, maybe stress, maybe family, smoking, and many factors can invoke this spasmodic dysphonia or abnormal voice production. And what are the various treatment options? You can start with voice therapy, counseling, maybe some medication like trihexyphenidyl. If it is not effective, the best treatment option would be a botulinum toxin injection, which we can inject through this area, the cricothyroid membrane. You take one needle and EMG guidance and inject 1 to 4 units of botulinum toxin into either sides. Can also be given through a laryngoscope. You can take the needle and can inject to the specified muscles depending on the type of the abnormality, whether it's a adductor type or it's a abductor type or it's a combination or something. So it is very effective, and the effect lasts for 2 to 6 months. Maybe you have to repeat it after some time. Okay, yeah. So as I've told you, this rare condition it's largely treatable by efficient use of a botulinum toxin either directly or through a scopy, laryngoscopy, and the effect is lasting for months. And many people around the world has been affected with this condition, and rarely early in the past people used surgery as an option, but of late we don't do surgery. The best treatment option would be a botulinum toxin injection to the hyperactive, overactive muscles either directly or through endoscopy. So, but of course, you should have a counseling, voice therapy in addition to this, and you may have to roll out stuttering, functional problem, or a strained voice, or a voice tremor, or some other problem which can start like that, maybe a nerve problem, maybe a 10th nerve palsy, basal ganglia disorder, cerebellar problem, brain problem, etc. But those things are extremely rare. If you get a typical history of a strained or breathy voice, you can always make sure that this particular patient is having this sort of a spasmodic dysphonia. Okay. So, as I mentioned, the treatment is voice therapy, drugs as well as botulinum toxin, which is largely effective. So, I think I could give you a brief idea on this particular topic of spasmodic dysphonia. If you have any queries or comments, you are welcome. Thank you very much. Bye.